Hey guys, glad you're joining us today. I'm Dr. Gosalia. I'm your host today. I'm excited to introduce Mr. Anthony Florek, who is the president of Soundwave Hearing. And why is this so exciting? Well, back in 2017, President Trump asked the FDA to change or develop some language for over-the-counter hearing aids. You've been hearing about over-the-counter hearing aids all over the news, all over social media. Some of you are worried about it. Some of you are opportunistic, which all of us should be, because I think this is going to be a very good, positive thing for the profession. As you know, just a couple months back, the President Biden really demanded that the FDA get this thing wrapped up. And so we finally got the language. Some of us were involved nationally in talking with the White House OMB and the FDA and making sure that patient safety is number one. Well, Soundwave Hearing is one of those companies, but what makes Soundwave different is that they're excited to work with us as providers. I've been working and talking to numerous over-the-counter companies over the past couple of years, including some who have disappeared, wink, wink, and some who are still here. None of them were interested in distributing through our offices, which meant that we would have to go to the store, buy them, and then resell them in our office, which doesn't really make sense. So I'm really excited to introduce Soundwave Hearing to everybody here. So Soundwave Hearing, of course, is one of the numerous over-the-counter hearing device companies. As you may know, a lot of trademarks were filed as soon as that happened. But what makes these guys different is that, number one, they have an app where you can go through and do a hearing test, which Anthony's going to go over in just a few minutes. And it only takes a couple of minutes. It's a very fast, simple process. You can see over my shoulder, I've been on the website, I've been doing my homework, and it really seems very simple. And I think it's going to be very effective for our patients. Couple more points before I get to Anthony here. He's patiently waiting here. They do have some artificial intelligence built in. So this is going to be an advantage for our patients. And one thing that a lot of over-the-counter device companies have not publicly stated, and it's not even in the federal guidelines, so it'll really depend on what our state licensure rules are going to be, is they're already ahead of the curve. They are offering a 45-day money-back guarantee for our patients. So those people who buy these, they already have that option. There's no rules to say that people have that opportunity. So we're really glad to see that you guys are doing that. So I've said enough. I think I want to introduce Mr. Anthony Florek. He's the president of Soundwave Hearing. Anthony, thanks for joining us today.
Thank you, Dr. G, for having us, Soundwave, on your program.
Absolutely. So tell us, I said a lot just now, but tell us from your perspective, like what is Soundwave Hearing, and give us a little background on how it started, please.
Yeah, you bet. So I'll give you 30 years in 3 minutes, and that's not all Soundwave. So I've been in medical devices for 30 years. The first 15 were with cataract surgery, cataract implants and phacoemulsification and LASIK surgery. And then I moved, I joke with people, I moved my way down the body to ears. So I spent 11 years with a network, Beltone, running their sales and distribution, managed care, training, all that fun stuff. And then after I left them in 16, and I joined a company out of a health tech startup. The company was called Matter. The health tech startup was called Resonance Medical, and they came out of Northwestern's Invo program. And they were putting together an audiogram on a phone, essentially, and a hearing test. And this was really fascinating to me. They had the software, wasn't yet complete. I was trying to help them license the software over a year and a half. And then I set out on my own in 2018 and started Soundwave Hearing. And one of my partners has expertise in manufacturing and global supply chain management. And his name is Joe Turek, and the other partner of mine, co-founder, is Chris Bovin, who's really the architect behind the Odoo app. So we bought the asset, Soundwave did, Chris, Joe, and Tony of Resonance Medical, and we put it together with a BTE hearing aid, which we'll talk about, the Santro hearing aid. And we launched, it took us about 3 years to develop it. And we always had the OTC guidelines in mind, especially when they came out with the proposed regulations last October, I believe. So we're an OTC hearing aid designed really to partner with the audiology community, and we could talk a little bit more about that. But we're on the market. We're going to be at the AudBoss show coming up soon, and we're excited to be part of this partnership.
Well, we're excited to partner with. So you talked about Santro.
Yes.
Santro is the name of the hearing aid. Can you tell us about Santro as a hearing aid and how it works, please?
You bet. So it's a 16-channel receiver in the canal, behind the ear hearing aid. It's as small as about any other OTC product that's out there in the market. We think it has a nice, crisp, clean sound. And we use the AutoTune app to drive the hearing test so the patients can program their hearing loss to the Santro hearing aid. So it's Bluetooth enabled. It's not yet streaming, but we expect to come out with a streaming product in Q1. And we expect to have a rechargeable streaming product out in Q2 of next year.
Wow. Okay, that's pretty cool. Bluetooth is definitely a topic that a lot of us are excited about, and some not so excited about. But we love the connectivity opportunity for our patients. That's an inside joke, Anthony, that probably you won't get, but we have some people who just get tired of working with our patients with Bluetooth connectivity issues. So we're excited to see that. And of course, rechargeable. Rechargeable has been something that over the past few years has just flourished. And at least in our clinic, we've had a lot of luck with rechargeable hearing aids.
Great.
You talked a little bit about the app and the testing components. So if somebody goes on the app and they want to do a hearing test, they can do the test within the app, correct?
Yeah, that's exactly right. So they would take the product home, sit down at their kitchen table, and take the hearing aids out of the box put the batteries, 312 batteries in, download the AutoTune app from the Apple or iOS or Android store, and they connect their hearing aids to their phones, and then they register, through the AutoTune app. It's going to be an FDA requirement. And there's a tutorial that sort of walks them through how to put the hearing aids on their ear, et cetera. And then they get to the hearing test. And we try to make it as simple as possible. It's two buttons, a blue left button and a red right button. And the tones that are in situ through the hearing aids. And it takes 3 minutes, and it tests all the frequencies, all the intensities in both ears in 3 minutes. And it's AI driven. So I'm going to use words that I don't really understand. And Chris Bovin could probably explain better, but they use basically non-linear algebra, right? That's the AI, that's the machine learning to really narrow in on a hearing threshold. Our results, we provide our results in the form of a report card. So it gives the patient an idea of where their hearing loss is, very simple to understand: low, mid, high frequencies, green, yellow, red. And what's an interesting aspect of our hearing test is if they have a severe or profound loss, or if they have an asymmetric loss, they'll get a warning message that tells them, hey, this technology might not be fit for you, or maybe you weren't in a quiet room. Let's take the hearing test again. And if they get the warning again, it really it tells them, hey, go seek the help of a hearing professional. And that's part of how we design the app to partner with the audiology community to make sure that we're treating the whole patient.
Yeah, and I want to talk about that in a moment as well, because I think, as I mentioned in the beginning, you guys are doing something different, because I won't name their names, but I've spoken to very big OTC companies as well, other ones, and none of them were interested in partnering with audiologists to be able to distribute. So why did you choose to do your model this way, where you work with us?
Right. So a little history in ophthalmology, and when LASIK came out at the turn of the century, everyone said, "Oh my gosh, the optometrists, the ophthalmologists who did the LASIK surgery was going to put them out of business." And we, as a manufacturer, we said, no, that's not going to happen. The ophthalmology community is going to partner with the optometry community and co-manage the patient. And both communities flourished. The patient ultimately benefited. And I think that model works here, which is why I designed our product to work with the audiology community and hearing care providers. We don't want it to disinterrupt or disintermediate anyone. We want to partner with the audiology community. We think there's a huge opportunity specifically for tested, not treated patients, right? And they can walk out of the office up to 40% or greater of the time, which makes it a really inefficient business model. And I know from managing a network that when a patient leaves, it's really hard to get them back, right? They go to Costco, they go down the street, they go online, or they don't do anything. And it's really hard to get those tested, not treated patients back into your ecosystem. So if maybe they're a younger patient, maybe they just have a mild to moderate loss, maybe they don't see the benefit yet of a prescription hearing aid, but if you can keep them in the audiologist's purview of care in their ecosystem, they can continue to manage that patient, right? And eventually they're going to fall outside of our indication and that's an opportunity to do a technology upgrade and fit that patient into a prescription hearing aid for the first time, and then the next time, and then the next time, and the next time. And that long-term value of keeping that patient in the practice, I think is super valuable.
Absolutely. And so you touched on a network and a way to refer these folks who either have asymmetry or a severe to profound hearing loss to an audiologist or dispenser. So how does that work? Like, how do you know who to send these people to?
Yeah, it's a great question. So what we decided to do, and it's not in the app yet, but it will be soon, is so the question we ask ourselves, okay, what do we do with those patients, right? I need to send them somewhere. And I really think, depending on how you look at it, that this is one of the biggest lead opportunities, OTC, for hearing care providers. It's going to be really fascinating to watch how the practices incorporate OTC into their own philosophy. And I think it's just a really great opportunity. You can't, there's tens of millions of dollars in free press out there. It's amazing. And the audiology community can capitalize on that and really filter more patients and channel those patients into their practice and get them started in their journey, right? So eventually, and this is one of our next public releases of the AudioTune app, will include a geo-tracking component so that a patient can, if they get the warning message and they don't know what to do, they go on the app, they press the button, it geo-tracks to the nearest hearing care provider in our network, and the hearing professional takes it from there. And we think that's going to happen a fair amount of time, and which is why I always wanted to have a network to partner with. I knew I couldn't build it myself, but if I can plug and play into Soundwave Hearing and Santro and the AudioTune app, we'd be thrilled with that.
Yeah, so if anybody fails their test in anywhere south of San Francisco, they'll all come to my office. I think it's the way that this works, right? You're gonna put me as the only provider that can. I'm kidding, of course,
Right.
and that's gonna come in an update. So we're excited for that. I know
Yes.
for at least for our audience here, just FYI, I'm 100% invested in this idea. So it's definitely something we're gonna do. The way that I plan to market this to our patients, we've already sent an email newsletter out to our patients saying, hey, here's over-the-counter hearing aids, they're coming and this is what you should know. But I think the potentially next one or the one following will be something about, hey, have you thought about hearing aids, but really don't feel like you're ready, or maybe your hearing isn't as severe enough and you want to try something, and then use Santro and Soundwave Hearing as maybe the carrot, if you will, to have them come in, and we'll have these products stocked in our office where they can come buy them, try them out, and if they do well, great. And then maybe in a couple of years they come back in for another hearing test, and then we upgrade them into prescription hearing aids, or they come back again and they buy another set of over-the-counter devices. Which
Right. I think if the audiology community embraces a cabinet solution exactly how you described, it may include a hearable, it may include a PSAP, depending on what price point you want to include. But hopefully it includes a Santro hearing aid. It's $9.99 per set, and we designed it that way for a reason. Right, because we wanted to be competitive and not a competitor. And we're not going to race to the bottom with this, right, in price. We really want to establish a couple of SKUs that I described, one with streaming, one with rechargeable and streaming, and play within that $800 to $1,000 price range, because we think that's probably the sweet spot in the OTC marketplace.
Yeah, I think anything under 1,000 seems to be the nice sweet spot. You're absolutely correct. And I think there were studies that actually showed that for an over-the-counter device. I think the stigma of hearing more so than the cost is really the issue, as we know from studies overseas where hearing aids are free.
Yes.
They'll have the same or similar penetration rates. But I think this is something that could be very attractive because as far as I can tell, the device is extremely small, right?
Yes.
It's a sleek looking device. I have pictures throughout the interview here that people have been seeing while we've been talking of the devices themselves. So you answered the question. My next question was going to be cost. So $9.99. So I'm assuming as a provider, we would be working with Soundwave Hearing and working out or negotiating whatever that number ends up being. And then
yes,
is it upon us to dictate what the cost is for the patients, or should we use the model that, hey, it's $9.99 for the patients?
We're strongly recommending that they use an MSRP of $9.99, and then we'll work on wholesale cost for the providers, and they're not going to make as much money as if they were to provide a $4,000 set. So they'll make that 30% margin. But here's the quick math. I mean, it typically takes $700-800 to get someone into a chair of marketing costs, and $200 or $300 of chair time, right? So that $1,000 to $1,200 cost that's walking out up to 40% or more of the time, it's not efficient. So you might make, 30% margin. That's a $1,200 to $1,500 swing in someone's profitability. And that makes a difference. If you can recapture one or two of those patients, the long-term value over the lifetime, of the practice is remarkable. And that's so, and then people say, well, wait a minute, how do we service the patient? And again, we leave the option up to the audiology practice. And I've gotten different answers. Yeah, we've been at AAA, we're at IHS, we're going to be at the AudBoss conference. And these are really interesting and engaging conversations for me. So the provider can provide that service. They may charge a la carte, they may charge annually, or they may decide that they really want to take those patients and let Soundwave do it as service. And we're happy to do that. And Dr. G, maybe it's a good time to talk about our partnership with Amplify.
Sure.
So we recently partnered with Amplify out of WashU and St. Louis. And it's a whole hearing healthcare platform. So we're not just trying to support a device, we're trying to support the whole patient. And these patients, the Amplify app will be integrated in the OTC app. So when they sign up for OTC, they'll have an opportunity to sign up 1 month free. It's a $50 value with Amplify. And some folks may know about it. It's a whole hearing healthcare platform. It has a peer support community, has a whole interactive curriculum, 12-week course. It teaches patients how to overcome a communication breakdown, how to become a more effective listener, how to speech read, all the basics that patients need to help with their oral rehabilitation. They'll be assigned a hearing health coach. They can get on a Zoom call. The first curriculum is all about how to set up your Santro hearing aids with videos, et cetera. So there's demonstrations. And we really think it's a strong way to support our app, our technology with the audiology community. And we're super excited to partner with Amplify and AudBoss.
Well, we're excited to have you on. So how can people contact Soundwave Hearing?
You can contact me straight up with right on my email. That's at the bottom of the screen. It's probably the easiest way. You can hit our website at hearsoundwave.com. And we're going to be at the conference. We love to engage in these kinds of conversations. You can sign up for a wholesale account right from our Hear Soundwave website on our professional page. Our product is starting to show up through some of the audiology wholesalers, which is great too. So we'll announce more about that shortly. But yeah, those are the primary ways to connect with me.
Yeah, and here's the website. It's hearsoundwave.com. Mr. Anthony Florek, before I let you go, I just want to say thank you, because in the last year and a half, with all of the gray areas about over the counter and all the back and forth with all the stuff that's going on, this is very refreshing for somebody like myself who still sees patients, not full time anymore, but at least part time patients. It's such a nice thing that we can offer our patients. And I hope everyone that's watching, I know everyone watching, not everyone is going to be at AudBoss in a few days. However, those that are going to be there, please stop by, visit with Soundwave. They're going to be there. And if you're not coming to the AudBoss conference, which is happening, sign up for next year. However, you can go to hearsoundwave.com and get all kinds of information. Anthony, before I let you go, do you have any final words?
Yes, our app and our technology continues to evolve. And when I managed a network, all the great ideas came from the providers because they dealt with the patients every single day. So, that's the kind of partnership that I love, is to bring those ideas to us, help us improve our technology, help it make it better for the audiology community and AudBossers. And let's work together in a partnership that we can treat more patients. That's really what I know the hearing care provider network and communities really enjoy. So glad to be part of the AudBoss community.
Yeah, and I think AudBosses are in general more early adopters and forward thinking. So I think this is going to be a great avenue for all of us to be able to use. So Anthony, thank you. Thank you so much. Thank you to Soundwave Hearing for their support of AudBoss, also for coming to AudBoss and for sharing this with us. I hope everyone watching will contact Anthony over at Soundwave Hearing, and we look forward to seeing you next time. Thank you very much.
Great. Thank you.